All right, here we go. It is what it is. It is, of course, the summit o'clock, and this is definitely where we actually come alive each and every Wednesday, 9 p.m., top of the hour, just to bring you some of those conversations that matter to you and I from different perspectives, and also we get to hear from different people who also usually join us right in studio, but also it's a moment for us to hear from you, from whatever part of the world you are watching us. This is one of the most interactive programs, and all you need to do is just join us through our social media platforms. And of course, one of those platforms that we actually are super active is the X platform. Just share with us your thoughts. And of course, the hashtag to use as always is the Summit RW. We are also live on YouTube, and of course, if you go onto my X platform at Eugene Anango, you'll be able to see the live stream link. Jump on it, share it, so that those who need to watch this tonight, those who want to put their voice on this conversation tonight, are able to actually jump on it. I'll be reading your comments on the chat section and also on the comment section, so just talk to us right there. If you're watching us for the first time, and if you're seeing me for the first time, or hearing this voice for the first time, as always, my name is Eugene Anangwe, and tonight on the program we're talking about a very sensitive issue, and of course it is an issue to do with water. It is a necessity, and of course for everybody, yet the sad reality is that it remains a luxury for many around the world. We're talking about around 2 billion people around the world who are still struggling to have access to the safe supply of water and sanitation, and of course health services. That is the conversation we're having tonight, and I want us to just have a conversation that we at least understand something about it. And this is what we know about the WASH situation, especially when it comes to the Rwandan case, but we'll also be expanding this conversation to a regional perspective, and achieving sustainable and universal access to safe water, sanitation, and hygiene remains a critical issue that, of course, it is linked to nutrition, good health, gender equality, which we'll spend some time to talk a bit right here on the program, economic growth, and of course environmental management. What we also know is that this particular issue of WASH has some numbers on it, and some of the numbers that we have right here that could change or might have changed as we speak right now, but we'll be able to go deeper into these numbers. According to UNICEF water, sanitation, and hygiene in Rwanda, we are looking at around 57%. That number could be higher or lower as of today, of the population that is able to access safe drinking water that is within 30 minutes of their home. We'll be able to try and understand how that remains a challenge, or what is being done to try and increase this particular number. We're talking about 64% of the population having access to these sanitation services. Are we still on this same number, or has the number changed, and by how much? We'll be able to hear from this particular conversation tonight. We're still on the numbers. 94% of the wealthiest households have their own toilet, compared to around 74% of the poorest households. Let's talk a bit about this in terms of how it is an impact when it comes to hygiene-related issues. Let's also look at this important fact right here. The population of Rwanda is projected to double by 2050. We're looking at around 70% of the people will be actually here, Mumuji Wichigali. And we're looking at that comparison from a 2012 level. By 2032, the total number of households is expected to increase from 2.4 million to 5.3 million, with over 100% increase. Our key question will be, are we ready to handle this population when it comes to matters access to WASH? I'm going to bring in my panelists on the program, and we'll be able to understand these numbers and, of course, the perspectives on this particular issue right here on the program. I want you to start tweeting. If you're watching us tonight, I want to hear your thoughts. This is not our show. It is all of us from where we are to put our voices on this particular issue. And I'm talking about solutions-focused conversations. We are here to talk about solutions. Let's try and hear what solutions you think can be able to help us in this particular conversation around access to sustainable, WASH services here in the country and, of course, in the region. I have none other than Maurice Kwizera, Regional Program Director, Water Aid East Africa. Thank you for making time on the program.
Thank you, Joseph.
Asante sana. Also with us in the program, we have Dr. Athanas Rukundo, Division Manager, Clinical and Public Health Services Governance at the Ministry of Health right here in Rwanda. Thank you for making time.
Thank you.
Of course, also with us is Mutaza Malik, who's the Chief of Water, Sanitation and Hygiene at UNICEF Rwanda. Thank you so much for making time. I want us to be able to understand this. We're looking at 2 billion people who don't have access to clean water. We're also talking about 31% of schools not having access to clean water. And we also know for a fact that if everyone everywhere had clean water, the number of diarrhea deaths could actually be cut by a third. This is according to the World Health Organization. And as we look at these global numbers, I want us to narrow down, first of all, for now, on the case scenario of Rwanda. Where are we at, Dr. Rukundo, from a Ministry of Health perspective? Then we'll expand and wade further in this conversation.
Thank you, Eugene. I would first start thanking you for organizing such interesting topic that comes, I would say, at the right moment. This week we are already conducting a country-wide MCCH week, Maternal and Child Health Week, where we are combining maternal and child health work with WASH work. And one of the biggest objectives is to address the issues of access to water and sanitation facilities, not only in the health facilities, but also at the community level.
Correct.
And as you also mentioned, WASH, it's a basic human rights like any other human rights.
Yeah.
So when you come to Rwanda, there are some statistics that you have already shared with us. When you look at the current progress, Rwanda has really made a very good strides in terms of achieving higher standards for water and sanitation.
Yeah.
Country-wide, the most recent population housing census showed that 82% of the total population are accessing water in their respective areas, homes. At least 92% of the population are also having access to improved water, WASH facilities. When you look at different indicators that are linked to the burden of these diseases, especially those that are linked to waterborne diseases.
Yeah.
Currently, 14% of the diarrhea diseases are prevalent in our communities, especially under 5. But when you look how far we've come, we've really tried to reduce these cases, and we still want to reduce those numbers until we reach 0.
Yeah.
And there are different statistics that we could talk about when you look at our health facilities, how we are accessing, like health hospitals. 100% of our hospitals now have access to, health facility, sanitation, WASH and, WASH, water and sanitation. This means toilets, water. When you look at health centers, the same. The biggest, out of 514 health centers that we have across the country, at least 500 have access to WASH facilities. And when you go down to health posts, that's where maybe we are still struggling.
Yeah. And I wanted to pause there. And then I want to say this, gentlemen, I think we should just end this show and go home. Because everything seems to be okay. I've had very beautiful numbers, 100%, I've had 90%, I've had 80%. Morris, we go home. Everything seems to be okay. I mean, what should we be addressing?
Thank you, Eugene. Thank you, Eugene. Yes. I don't think it's time to go home. Yes, I will agree very much. But let me first start by thanking you very much once again, myself, because this is an important topic, actually, because I work with an organization called WaterAid, and we truly believe that water is life. That's a chant that everybody says, talks about, and it's true indeed. But Doctor says is mentioning about good statistics.
Yes. I want to hear what are the gaps.
But it's not time to go home. It's not time to go home,
Okay.
Actually, accessing or providing services, water hygiene and sanitation services to people is one thing, but sustaining that access forever and for everybody in an inclusive way is another issue, is another thing. So we, at this time, we probably need to start thinking seriously about how we sustain this success. Yes, Rwanda is achieving very good outcomes in terms of providing access, but sustaining that access and making sure that we leave no one behind is another issue. So we are still here. A lot of work to do.
Now, let me build up on that particular statement that you made. What are the areas that we need to fix, especially if we want to achieve the sustainability of this particular success story that we had from Dr. Rukundo? What are the gaps? What have we not talked about that you feel it is time for us to start talking about that if we want to achieve sustainable access to wash?
We cannot achieve sustainability without putting in place a sustainable mechanism to finance water hygiene and sanitation. That's one. Second is about behavior change. Behavior change is a big component. Actually, I truly believe that the soft component of WASH is equally important than infrastructure.
Yeah.
Because behavior change in the social, hygiene and the social behavior change is a lever of the demand and the use of sanitation in the water services.
Yeah.
If you don't teach people about proper use of sanitation facilities, you will find these sanitation facilities that are disgusting. You have met one of them maybe in a school somewhere or in a healthcare facility or in a household. So hygiene behavior change is important in terms of sustaining demand and the use of services. And as I said, financing is a big issue. Financing and, you know, water and sanitation services are now threatened by climate change. The same way we use it to construct a facility without droughts or flooding has changed. So finding a way for government and other stakeholders to put in place sustainable mechanism to finance WASH is important.
It's important. And we'll come to that because I've seen a lot of great work from WaterAid in terms of mobilizing resources and channeling it to try and bring a change. Let me bring in Malik here. Malik, at UNICEF, we've actually, and when my good friend Xavier, who's actually helps us with the data or statistics on this particular program, was actually working around what he was doing, there was a lot of research or numbers or data coming from UNICEF, especially on this particular issue of WASH or access to WASH services. Beyond just churning out these numbers, what more can we see, or what more would you be able to tell us UNICEF is doing or has been doing or can do in plugging into what Maurice says? We need to sustain the gains. We need to have, you know, proper financing mechanisms to be able to continue achieving even more.
Thank you. Thank you very much. I think I'll first refer to the data question on data. I think we have made remarkable progress in terms of meeting the MDGs. But SDGs set the bar very high. Now the challenge is to help the people move up the service ladder. Doc talked about access to improved water supply, which is now 92%. Sorry, 82%. But our access to basic water supply, which means a safe water source within 30-minute round trip, that according to DHS is 55%. So we need to help people move up the ladder and reduce that travel time and round trip time to make it less than 30 minutes. Similarly, our around 18% of the population has access to household water connection, and we know government target is now to increase this considerably by 2030, and then to have universal coverage of household connection. So this is another challenge. If we talk of sanitation, our access to improved sanitation is 92%. But when we talk of basic sanitation, this is 72%. Over the last 4 years, we have increased sanitation by almost 11%. That's a big jump. But again, there is a lot of sharing in urban areas. There is also people who are using unimproved sanitation facilities. So the challenge is now to help them move up the ladder. Then when we talk of financing, there are huge financing gap. Currently, we know government of Rwanda, under the current budget, increased the financial allocation for wash sector by almost 30%. But if we want to achieve the SDGs, we have a funding gap of over 300 billion Rwanda franc per year. So we know government is moving in the right direction. We have increased the government allocation. Efforts are being made now to mobilize funding from innovative financing mechanisms. But this, I think, if we want to achieve SDGs, we have to considerably increase our financial education. What UNICEF is doing, we work with the government to develop a financing strategy for voice sector. Last year, it analyzes the funding landscape for voice sector, analyzes how much current allocation is going into water supply, sanitation, hygiene, wash in school, wash in healthcare facilities, and also comes up with the numbers, how much funding we need to achieve the SDGs, to achieve the NTS targets, and also what are the strategies to enhance financing for the voice sector. Thank you.
Interesting. We'll come back on some of the key creative ways that probably we know to analyze and would be able to recommend in terms of accessing, financing. But let me go back to Dr. Rukunda before I come back to Maurice. Dr. Rukunda, I'm sorry, maybe I might have burst your bubble when you had started, but let me just fix it in that sense. I want to understand, for someone who's watching and has heard those statistics, when you're talking about those numbers, 90%, 80-something percent, 70-something percent, over and above that, what has been the strategy? What has been the driving force to achieving that? And how do you ensure that that is sustained? Because Maurice mentioned and raised the red flag. We can have good numbers, but if we do not work towards keeping that momentum, then it's easy to actually go back many steps.
Thank you so much. There are lots of statistics that we could talk about, and I know this is where we have achieved a lot, and we still have to celebrate those gains. And we also have to look at the data and see where we are still struggling, so that we know we need to design new strategies to address these issues. And there's a lot of strategies that have been put in place. It's very interesting that these colleagues have been part of this initiative. We have like the popular one that is the community-based environmental health promotion program. This is a homegrown solution where we have organized our villages into like clubs, and these clubs, like, they gather in their communities. They identify different wash-related issues. Is it an issue of infrastructure? Is it an issue of maybe diseases that are prevalent in their communities? They try to identify those issues and get the solution. So they look at the community, identify the issue, design an intervention that is going to address the issue. This is like a community-led intervention, but there is also that guidance at national level. And part of this, there are a set of guiding documents that the Ministry of Health has already designed to lead these conversations. They have different courses they are taking. At least we make sure that each family has a representative who can participate in these platforms, and can be taught on how to treat water, how can you treat well your sanitation facility, and you can design any intervention to address the identified gap. That's one, and it's available countrywide. All districts are implementing this, and it has really generated a lot of outcome. The other initiatives we do have, of course, as the Minister of Health, like a policy-making government institution.
Talk a bit to what Maurice mentioned, the behavior change aspect, because that's very important.
The policy perspective. The biggest initiative we have around behavior change is this initiative of CBP, in short, is that community-based environmental health promotion program. The biggest target is to change the behaviors of these communities. You cannot change the behavior when they don't have accurate information. Why should I bother washing my hands when I leave the toilet? So we try to teach them why it's important. If you're talking about stunting, why should they wash their hands or clean everything they're using so that they prevent this stunting? So we are trying to change the behaviors, but working with the communities to be the ones changing that. So that's one of the initiatives. And we have other initiatives
which we'll come to in the course of the conversation. I want to talk a bit of fact that we mentioned right there, especially in terms of the population growth or projections that we are going to see. We're looking at 2.4 million, to 5.3 million which is around 100% increase when you're looking about the total number of households expected to increase within, the Rwandan space by 2050. And looking at this particular projection, in terms of what you mentioned earlier on, I think the concern here is how are we ready? Is this a concern? Should we be worried? Or these numbers should be some of the numbers that excite people like you within the space that you're in? How is the preparation to tackle this shift that is coming? Those people are coming to the city, and the pressure that the cities will be facing. What are the areas that you are plugging in as water aid, to try and ensure that there's no crisis on this?
Thank you so much. That's a very good question, actually. I think the long-term planning is very important for water hygiene and sanitation services. As water aid, you have been working with other stakeholders in the government on supporting districts to come up with long-term plans. We call them WASH investment plans, like 10, 15-year horizon. And the plan looks at the available demand, the projection in the demand based on the population growth, and or other parameters. Water, let me take an example on water. Water has multiple uses. And when you look at household consumption only, you miss it. You need to look at multiple uses of water. Water is used in agriculture, is used in tourism, is used in household consumption. So when you consider all these parameters and you project the use and the demand, that's where you can come up with a long-term planning to get exactly for this demand, and increasing demand. Demand is going to continue to increase. And you talked about an important element of urbanization. There is a lot of pressure on urban areas. It's not just in a country like Rwanda, it's everywhere in East Africa, especially in Africa, the whole of Africa. We see more and more people who want to go to live in cities. And there, the main issue actually becomes sanitation. Catering for sanitation in the urban is a big issue. As my colleague said, the government is doing its best, to be honest, and I applaud very much the efforts of the government of Rwanda in terms of providing services, but sanitation in the urban remains a big issue. The settings in our urban areas. We are still using pit latrine in many households. So when pit latrine fills up, what happens? What happens? It's a big question. Because there is no plan for pit emptying, for example. There is no plan. Even the people who are intervening in sanitation, I'm just taking an example on sanitation. Even the actors who are working on sanitation, they are working in isolation. Those who try to empty the pit work in isolation with those who should transport and transform and reuse. And this becomes a big issue. As I said, in most cases, when a pit are full, fills up, we see very bad behaviors and practices of people emptying to dump into drainages and everything.
Wow. I want you to park there or pause there. And as you think about the response to that, Dr. Rukundo, because I want to understand yourself as an epidemiologist yourself, some of the things he mentions in terms of seeing this ahead of time and what is being done to try and avert that potential crisis from a hygiene perspective. I want you to be thinking about that as I talk to Malik on the aspect of the population growth that we are seeing, and what would be the best ways to plan for this population explosion that we are talking about every time. Is there a crisis that we are looking at, a looming crisis in terms of stretching or straining the available WASH services or resources, or what can be done or should be done to ensure that even as 2050 comes, we are saying, come on, bring it on. bring more, come to the cities. We are ready actually to handle all these numbers. What should we be doing as we look towards 2050?
Thank you very much. As I mentioned earlier, we supported Ministry of Infrastructure and WASAC and working with the partners in development of wash sector financing strategy. Now that clearly says works of cost estimates on how to achieve SDGs, but also taking into consideration the population projection.
Yeah.
And Maurice talked about sanitation, urban sanitation. We're working with City of Kigali to develop guidelines for emptyable latrines, because latrine, emptying a latrine is a big issue in urban areas. We've also helped City of Kigali in doing situation analysis of fecal sludge management, which is now feeding into design of fecal sludge management plan. But we're also working with the partners to do the investment plans for the district, and we also supported the government in development of national water and sanitation policy. And then, most importantly, to enable the government track the coverage of wash services in both urban areas, rural areas, and the district level, we have worked with the government and partners to develop wash information management system. Now, so far, 2 rounds of data collection have taken place, and this system is able to provide us reliable and up-to-date information on wash coverage in both urban and rural areas. Then another aspect is climate resilience. We're having flooding in urban areas. The floods which occurred in May this year, and landslide, 8 major water treatment plants and 100 water supply systems were damaged. We know also many water supply systems in urban areas were affected. We have worked with Ministry of Infrastructure and WASAC to undertake climate risk assessment for wash sector. We've also undertaken a climate landscape analysis for children for whole of the country. And now we are supporting WASAC in development of a strategy and action plan for climate resilient services for both urban and rural areas.
Right, so the future is bright. The future looks bright.
Yes, but we have to do a lot of work.
We have to do a lot
make
more.
sure that we
Dr. Rukundo, back to you. He mentioned some very, I was just trying to picture that scenario as Maurice was speaking when it comes to how the pit latrines, when they fill up, and the way or the nature of how people are actually emptying them. I'm so sorry for those who are actually having a meal right now. But I want to talk about what is being done to avert this, because if this is the scenario, then there's a problem somewhere. Heads should be rolling. Who's sleeping on the job?
Thank you so much for the good question. Yes, what my colleague has shared, if you don't really pay attention, we might have a lot of disease related to these issues. But good enough, the Ministry of Health and other institutions have really started working on these issues. With other partners, the Ministry of Health has already developed a guideline, a national guideline, to guide the population on how you can construct a latrine that has, good or quality conditions that we wish the population to have. There are those who go and try to dig a latrine for like 20 meters or more than that, saying, this one is going to, last longer. But when you see the effect that is linked to that, we are likely going to contaminate the underground water that is, most of the population we are consuming. So we have developed that guideline, and it gives directions or different specification on how you can construct these latrines. It has to be like maybe between 5 to 6 meters. You can empty it when it's full. If you have a very good system to empty it, you can actually do it. There's a purification mechanism that they use. You can separate water and the rest, and you can actually generate some how do we call it, for agriculture, fertilizers. You can still use this water. Initiative is a national drinking water quality monitoring and surveillance strategy. We are, giving the water to the population, but do we believe, or are we able to assess the capacity, the quality of this water that they are consuming? So we are monitoring the quality of the water that is being distributed to the population. Whether it's the public or whether it's the health facilities, we are able to distribute different testing kits that you can use to check whether the water you are consuming it's of good quality.
This is already happening?
It's already happening.
Since when?
Long
I want
time
to know.
ago.
I live in Kagarama.
Yeah.
I want to know the water I'm drinking, the quality level.
You can be
Where do
sure
they
that
check? Where do the people within those areas, because we're about citizen-centric approaches, such that people are able to also, push for accountability. That this has been done. There's been a lot of investment. Partners have put in or sunk in their money to actually ensure that is available. Where do they know? Or we're just drinking water, kwera namazi, just drink.
Maybe we need to do a lot of work in disseminating this work. But if WASAC is treating this water, we have to go there and confirm that the water they are distributing to the population is of good quality. For health facilities, we go there and check, and even distribute toolkits that they can use on regular basis to check whether water being distributed to our patients also has very good quality. And I can't say that it has started maybe since when, but it's a work that is being done.
In progress. I want to read some comments and then we come back to the conversation right here. I'm loving the conversation in terms of the comments that we're seeing online, and I want to encourage all of us, just jump on this conversation. It is all our conversation. You mustn't be here in studio right now in this panel for you to participate in this very crucial conversation. From wherever you are, that's why we've opened up all our communication channels in terms of openness for you to be able to share with us your thoughts. And I'm going to read some of the comments that I'm seeing right here. I have Peter, who's at Simon Muhire, who says, soft skills are so needed to everyone. Wash facilities should be accessible to young people with disabilities. This is a very interesting point or thought process, and I want to understand what is being done from that particular area in terms of ensuring, access to all. From a UNICEF perspective, how are you contributing to ensure that there's, equality, access to everybody from this point that I'm reading right here, and then I'll come back to another one.
Thank you very much. Very valid question. When we're supporting the government in development of wash sector policies or strategies, we're ensuring that the access to vulnerables, people, elderly, people with disabilities, and girls and women and children, this is integral part. If you the recently approved policy, the new National Water and Sanitation Policy was approved by Cabinet last month. It has a dedicated section on gender, and it clearly mentions the vulnerables, the children, and people with disabilities. We're also working with Ministry of Education on provision of disability-friendly and gender-segregated facilities for wash in school. We're also working in wash in healthcare facilities. And most importantly, under sector coordination framework, there is a dedicated group on gender and access for people with vulnerabilities. UNICEF, along with other partners, we're closely working with the government on advocating for this. We're also currently implementing a project in collaboration with our child protection colleagues, which has also various associations working on disabilities. We are targeting the household where we have children with specific disabilities. We have undertaken a sort of a special assessment of what are their needs, and then we are upgrading the latrines to suit the local context and the needs of those specific children. But in many cases, we are procuring specific equipment to enable those children to use latrine.
Yeah, that's very interesting, because it's rare that you visit a school and you find a latrine or a toilet that is designated or designed for children with disability. And I think even in institutions, they are usually just made not because those children are in that school or not in that school. I think there has to be a commitment or a deliberate approach to that. Whether there's a child with disability or not, they have to be there in that particular sense.
I was actually going to add that earlier I referenced the community-based environmental health promotion program. And part of this program, it's interesting to see that disability, gender, all these issues are, are discussed in these courses that we are giving to the communities to change their behaviors. And we are ensuring that persons with disability are able to access the services like any other person. And as we're also saying, for these infrastructures, maybe the older infrastructures, it's an issue, and we are working toward changing those conditions, at least for new facilities that are coming, whether in health facilities or schools, whether in private health facilities. One of the checks we do every day is making sure that these facilities are accessible to everyone, including those persons with disabilities. So I would say again that the future is bright for everyone.
For everyone.
Yeah.
And I think we'll try to see how to actually account for that.
Yeah.
When do we check? When do we ensure that that has actually been done?
Maybe
Yes.
it's really good that we are on a good move in terms of inclusivity.
Yes.
Earlier on, I talked about leaving no one behind the principles. What my colleagues are saying are true. If you check at least in newly built infrastructures in schools and healthcare facilities, you will see some good initiative or that thinking of being inclusive is there. But it's a journey. It's a journey we need to engage on. You'll be surprised to go in a school, you find one stance designed for children with disability, but the wheelchair cannot turn into that door, for example. Meaning that we're on a good move, we're making a very good effort, but we need to continuously reflect on what we are doing. Maybe making people with disability more included in the design itself and in the planning to make sure that we are really doing something that is designed by them, not for them, by someone else. That's very important.
Very key that you mentioned that. And I want to mention something else, especially on the aspect of inclusivity. And, we came under fire today, especially on the constitution of this manual. I'll not call it a panel, because it is all men seated talking about WASH. And the idea here was, or the thought process that I had in my mind was, it is 2023, the 21st century. Why is it that WASH issues, or why is it that women are still having to bear the brunt in terms of the levels for lack of access to WASH services? Today, if we don't have water or sanitation facilities at a place, it is mostly the women who will actually suffer the most if they don't, take a shower, if they don't have access to that water to be able to cook or stuff like that. I want to understand why that's a big issue today. 21st century, 2023, women are still the most disadvantaged when it comes to lack of access to WASH. I could be wrong. Am I?
You are not wrong. You are not wrong. You are right. There is that aspect of patriarchy that is involved in WASH. In many African communities, it's just women and girls who spend hours and hours to fetch water for their family. And eventually, they're not the main users of that water, by the way, when it gets home. We always say in the WASH sector that women and girls are part of water infrastructure, for example. They have become like part of the infrastructure. Why? Because when an utility lay a pipe in a community and is not able to reach all the household, for example, the distance from the pipe or from the source, a spring somewhere, up to the home, that's a woman or a girl. Unfortunately, there is this aspect of patriarchy. Earlier we talked about behavior change. There is a lot to do in terms of behavior change in the mindset. To ensure access to everybody leaving no one behind. Patriarchy is a big issue in access to water in Africa. So that's something we need to really fight and make sure that everybody contributes to maybe providing water to the household. By the way, in some communities, when you go around in our communities here out of Kigali, when you find a man fetching water, you can make sure that that water is not going home. Eventually, it is going to make mud bricks that will be sold, and money ends up being spent in
other
unnecessary
areas.
Yes. But it's part of the behavior change you talked about. It's part of the mindset change you talked about, yes.
Dr. Kunda, I'll tell you for a fact, in some villages, even back in our village, you know, for you to be seen as wife material, it was actually part of the process of being sent to the farthest point of where the river is, to be able to bring water. And that water is for your husband to bathe and then for the children to bathe. And I want to be really clear here that it is 2023, it's the 21st century.
Yeah.
How is it that this is still going on? What is it that we have missed out on in fixing this problem in terms of the behavior change that you even spoke about earlier?
Yeah, thank you so much. You know, on this work about, you know, all these human rights we are saying, it's a progressive realization, and there's a lot that has been done, and there's still a lot that has to be done. When you look at how these behaviors have been, you know, changing over time, it's really promising that maybe in the near future we have a lot of changes. We used to have, we used, like 15, 20 years ago, the same number of, you know, girls who were in schools is not the same like today with the current. If you check, there are, you know, a lot of discrepancies, but moving in the right direction. If you try to look at how the principle of gender equality or equity is now perceived, it's changing. We used to have women who could not even think of going into science-related topics in school. But these days, it has changed. So for me, I'm positive that these things are going to change. When you look at different strategic documents that we are putting out there, the different legal and policy documents that we are developing, they are all taking into consideration all these issues. The same program I was talking about is talking about how gender has to be considered, how this wash is a women issue, and the community, seeing the community sitting down to discuss how they can address that problem of maybe fetching water. If I send my son to fetch water, it doesn't harm them to, you know, fetch that water. So in Rwanda, I would say that I'm positive about the change.
The trends in terms of the change. Malik, I mean, is it a concern? And then from where you sit, your thought process in terms of how we fix this, in terms of behavior change and ensuring that women are not remaining as the disadvantaged. Actually, no one remains disadvantaged in terms of lack of access of wash facilities. How do we ensure this is a reality?
Thank you. As my colleagues have talked about it, you know, we're working with the government to integrate gender equality in key policy documents, in strategies, in plans. We're also working with the partners to make sure when the WASH projects are implemented on the ground, women, children, and people with special needs, they're engaged in planning, design, and actual implementation and monitoring of the interventions. And when we're also reporting on the data, we must report gender desegregated data. Now, if you look at like the population and housing census, it clearly shows that there is a big disparity between men-headed households and women-headed households in terms of the access to wash services. I think, as my colleague said and Doc said, I think we have taken a good start, but there's a long way to go. And we really need to strengthen engagement and active involvement of women and girls in all phases of projects and also policies and strategies.
Interesting. Let me bring back the comments from our social media platforms. I have none other than Jeanette, who actually says, I love this topic. It's made me think of these mothers who are still struggling to get water to wash their dishes, their clothes, bathing and drinking. I think on the issue of behavior change, UNICEF, WaterAid, and the Ministry of Health need to work with us, social entrepreneurs. This is very interesting, Jeanette, and would love to hear more of your solutions-focused approaches to this particular issue. What do we do in terms of moving that particular needle forward in terms of ensuring that we're seeing a change in that area? Now, you say, imagine that you can't get drinking water for free in town. Imagine if we have drinking water taps in different locations, either in town or rural areas. I think this could be a potential solution. You know, even when we go to town, public, you know, toilets a place where you need to actually relieve yourself, you've got to pay. Times are tough. Dr. Rukundo, who do we need to talk to so that we can waive the charges for this? What do we do for that person who actually is stranded in town and they don't even have transport, they don't even have anything? How do we deal with this from a policy perspective, or someone has to do business anyway?
Yeah, thank you so much. There are actually a lot of initiatives that the government has been, doing, and part of that we have also having what has led to this success. We have had different collaboration and partnership with different stakeholders, and I want to come back to the follower who has just commented about engaging the social entrepreneurs.
Yeah.
We do have some entrepreneurs who are already doing business in this, who are selling water that is well treated to the communities. And we've been seeing some public toilets that are being constructed, not only in Kigali City, but also across the country. And maybe the issue we maybe try to look at is how maybe
can we
able
make them
to
free?
How do we make them free to
I don't agree.
everyone, but they need to be maintained.
Boris, are you holding any shares?
I don't
Can
agree.
you declare first?
I don't agree with making them free. I agree with, multiplying those places, the public sanitation facilities and oceans. But again, coming back to the sustainability aspect, to be sustainable, we need to pay for that service to maintain and sustain that service. Maybe the good thing in Rwanda is that there is always an option for people who are at disadvantage, who can't afford. There is always that option. But for other people like me, I can't just go and use a public toilet without paying. It's not good. We need to pay.
If it's 100, you should actually pay 20,000.
No, that's you need.
If I can add, I think to properly maintain the wash facilities, can't have these free things
for free.
But we have to make certain exceptions for the people who are most vulnerable. And even under existing water sanitation policy, there is a provision for the most vulnerable people to get a couple of jerry cans free of cost every day. We're also working with Ministry of Health. Like we implemented last 3 or 4 years with Ministry of Health, we implemented a major sanitation hygiene project in 12 districts, which benefited over 600,000 people. And we work with Ministry of Health to modify the traditional CLTS approach and brought in an element of subsidy, where we provided actually subsidy, some supplies and cash to the households who could not afford to build sanitation facilities. So certainly we have to make exceptions.
But he's talking about something important, similar to regulation of sanitation, actually. Yes, I agree, as I said, I agree that a cost needs to be attached to the service. But then how do we have a standardized regulation around sanitation services? It's important to avoid a situation where someone comes up with an affordable tariff, for example. In a local market, maybe requesting for 300.
Or even less.
Or 200. Sometimes feel like, no, it's not affordable for everyone who is in that market. And people end up going somewhere to ease themselves. So that aspect of regulation is important.
Interesting. I'll read another comment before you come in, Dr. Rukundo, from Noari Olivier, who says, what are the current challenges in achieving improved wash conditions in Rwanda? That's number one. Number two, what initiatives or programs have been implemented to advance wash conditions in Rwanda, and how can individuals and communities contribute? I love this because he feels we can contribute. We want to know, where do we plug in? And that is the question in terms of improving or bettering the conditions of wash in Rwanda. Let's talk a bit about the challenges, just real quick as we go. What's the biggest challenge, the number one challenge?
I think we've kind of covered those challenges previously. For me, the biggest challenge I would consider now is making sure that we're able to protect the facilities we already have, to maintain them, and make sure that once maybe one item is broken, we're able to replace,
What can Nwari do to support?
So there's a lot that Nwari can do. As we said, we talked about these clubs that are at the community level. the communities come together, identify these issues. So if he goes in his community, try to work with his community, identify maybe the possible gaps that are in the community, address them, of course working hand in hand with the other community members. It's something that could really
help in that sense.
Help,
I'll read another one from my bestie, Zanga Sylvie. And Sylvie is saying, water is a basic need and its commercialization is a human right abuse. That means a poor person somewhere who doesn't earn $1 a day cannot access it completely. Imagine a situation where a woman menstruating can't access water.
Again, we come back to the discussion we're having.
Maurice said
there's no way we can.
A cost has to be attached to it.
But the government has done
from this perspective.
The government has done a lot. If you had to see like how much the government is investing into making water accessible, like potable water to everyone, there's a cost that is attached. But when you see how much the population is paying, if you were to charge them according to like the inputs, then water would be very expensive than it is today. When you see how much they're accessing it, maybe the same rate I'm paying, it's not the same rate someone who is in Nyamagabe or anywhere is paying. So they are paying at a reduced cost, incentivized. It's not free for them. Even if they access it for free, it's someone who has invested some money in it. And this is the government. So
we'll come to that. Do you agree? It's a right
I agree. Yes, I agree. It's a human right. But that debate is a big debate.
Big debate.
Water as a human right and water as a commercial good. It's really a big debate. If everyone would access maybe water from the spring, you can say it's right. There's no
take it for free.
You can take it for free. But if you live in Kigali and the water has come all the way from Zove or somewhere else, and all the treatment aspects and transport aspect and all the services of billing and everything, it can no longer be just free like that. Yes.
We have 3 minutes to go. And I said when I actually posted this that this is just the first of the series of these conversations around WASH. We'll have another episode where we'll have Even Wasak here to just talk to us a bit about what efforts have been done to actually extend water throughout the country and all that. But I want us to just close on this particular area. Where do we see progress in terms of the next 2 years, 3 years? What are the areas that you foresee in terms of fixing where we have gaps in ensuring that everybody is able to access and it is actually accessible in a sustainable way? Just real quick.
Thank you. I think we've already talked about key challenges. One of the key challenges is the sector financing. We know government is increasing the budget, but government cannot provide all the resources. And I think we partners need to come and we need to go for innovative financing as well. And this is what we are working with the government to mobilize innovative financing. Like we have recently developed a funding concept note to mobilize fund from Green Climate Fund. We're also working with the partners to mobilize the banking sector so that they can offer special credit lines. So if you want to build your sanitation facilities, if you want to have a rainwater harvesting tank at your household level, you want to upgrade your plumbing system, you want to have a water connection, you're able to go to the bank and like you're doing for housing sector, agriculture sector, and access loans.
Good. Thank you. Dr. Kundo, real quick.
Yeah, thank you so much. In Rwanda, I would say that WASH facilities, it's a human security issue, and we know it has a direct impact to the health of our community. So the biggest challenge for us is to make sure that the population access these services. I mean, WASH, water, sanitation, wherever they are, in their respective homes. For us, that's the biggest challenge we have ahead of us. And in addition to what he was saying, these facilities are already existing. There's some inputs that the government is putting there for anyone who wants maybe to
plug in.
Right.
Maurice, you have the last one.
Thank you very much. First of all, I need to support very much the idea of, and applaud the idea of government of Rwanda making of sanitation a human security issue. It's a lesson that you are taking even to other countries in the region, because not having a sanitation facility for a household is considered a human security issue, and everybody, local government, partners come together to make sure that the household is provided with a service. That's a fantastic move. that the government of Rwanda has taken, and it gives hope. It gives huge hope.
Yeah.
Second, to close, I think we, as WaterAid, we are really encouraging all people to come together for collective action. There is no need to do sporadic interventions. All partners, development partners, local government, private sector,
can work
coming together will make it.
Right. That sound is saying, Eugene Anangwe, you need to leave because it's time to pave way for the news that is coming up in just a short while. But I want to say thank you for making time for this first edition on WASH. We'll have more of this. And I want to say Sylvie and, of course, Annette and our friend Leon Laura. I'm hoping to have you next week right here on this particular show, if we can, or the next time we're having this particular conversation. That is a promise I'm making. And, of course, Nash. We'll talk about that also next time. Thank you for making time. Thank you for always being part of the summit. As always, my name is Eugene Anangwe. Goodbye and good luck.